We are going to talk about the OSCE procedure of the vein puncture. No, don't not OSCE, but when for someone preparing for OSCE. So this is called venous puncture. Venous puncture when you have you as a nurse and you have the patient and also the materials. They are free actors. To act as when the patient and you should use materials for the procedure. So you should prepare yourself, the client also should prepare materials. So materials you should need include the tray, with cleaned and disinfected plates, sterile cup, compressors or sterile pads. You should need a tray with cleaned and disinfected plate. This is not a sterile procedure, it is a cleaning procedure. Then sterile cup, which contains sterile gauzes, comprehensive sterile pad, bottles or tube with sampling if the sample was ordered, needles, IV, which are a vaccine system, laboratory forms completed and signs, syringes corresponding to the blood volume to be taken. You should use syringes corresponding to the blood volume to be taken. Kidney dishes. Their dishes are like a kidney shape and they are there. We have disposable gloves. You should wear gloves which are non-sterile while doing this non-sterile procedure. Should have a draw sheet, adhesive pads to mark the date and the time where you take the at which time you take the vein, with scissors, with a tourniquet, with a container for pricking and sharp objects, and with a disinfectant and alcoholic to clean before inserting the vein, and with labels. So implementation of this procedure is that first of all you should wash hands, you should wash hands. Then you should check medical prescription if the patient was given. You are going to do this procedure of taking IV line, or also known as venous puncture. So you are there. What you need to know is it the patient when you are in an exam? Is it the patient going to receive sampling, or is it hospitalized the patient who he already received the blood sampling exam? So you should wash hands first. For all procedures, should wash hands, check medical prescription if you are going to collect the sample or taking IV only, and the medical prescription, I mean the dosage or of the drug is going to receive, because you can give IV drugs. Determine with the patient the position of the arm. Avoid the arm which was punctured or which has trauma. Instead, the patient in the ubiquitous dorsal position or seated with the back greatly supported. You should not take the IV line for the patient who is sleeping. If he is able to if he is able to sit in the ubiquitous dorsal position, you should tell them. Then place protection under the limb to be punctured, because if you are going to puncture venous puncture, there are many veins you can puncture. They are not only the arm veins. So observe reaction, observe reactions from the patient throughout the procedure. Inspect the vein and decide the patient. Put on protective gloves. Locate the vein by stimulating the circulation if necessary. How stimulate the circulation? You do like venous return by stimulating using your hands. Then they place the tourniquet at approximately 10 cm at the top of the puncture site. For example, this is the puncture site. You count 10 cm. 10 cm and is the one. You see puncture site and you count 10 using one finger, 1 centimeter. Then you count 1, 2, 3, 4, 5, 1 to 10 centimeters. So then press massage and press on the vein along its way in a movement of venous return. So select the vein, disinfect largely within approximately 1 minute. Disinfect the puncture site. When you see where you're going to puncture, you should disinfect largely with approximately 1 minute. Then take the catheter packing and open it. You should open only the catheter pack after observing the vein you are going to puncture. Sterilize the vein and the skin by means of the thumb and facilitate the insertion of the needle, so as the blood will not come from the vein. You should fix the vein. You see the vein, you should fix it, and then the next you should and the rim with a free hand, the thumb pressed a little below the puncture site. The skin toward on itself by means of the thumb, then insert the catheter at an angle 45 with the bevel upward. So hold the skin for 1 centimeter approximately at the place where the needle should penetrate in the vein, but without penetrating it. Here you do. Then press the angle for the needle at making it parallel to the skin and for the direction of the vein. You should insert at an angle 45. Then after you should deduct to the angle of 15 degrees, so as the skin will be, the vein will be parallel to the skin. Penetrate the vein either from the underneath or from the side. Then bend the needle nose. Then flip out the bar gently, connect the vactina. Put the syringe in sterile packing. Then clean gently. Remove the tourniquet. Use sterile compress at the adjustable needle and draw this one quickly. Immediately the needle in the container. After removing, you should remove the sharp object and put them in the sharp container. Obtain a light pressure relief puncture for a few seconds to see the reaction of syringe. Put blood in different tube, then a small compressive bandage and fix it to an adhesive plate, and the patient is placed on that small bandage while holding the arm in a vertical position during few minutes. Very significant for the subject of anticoagulant or antithrombolytics. So the last says that the patient to press on that small bandage while holding the arm is in a vertical position during few minutes. Very significant.